We're good to go, Sonny.
My steel delivery truck got there about 5 minutes to 7. My steel delivery truck got in about 5 minutes to 7, so I had to unload him.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Sam, if you call the roll, please.
Commissioner Hooper.
Those guys' pants.
I know. Roll call. Here.
Inman.
Here.
Stepka.
Here.
Richardson.
Here.
Thomas.
No.
Max Bauer. Please.
Present.
Chairman Wheelock.
Yes, ma'am. Okay, we're missing a couple, but we do have a quorum, so we will continue. First order is the approval of the minutes of the September 1st meeting.
Sure. So moved.
Motion by Thomas, supported by Inman. Further discussion? All those in favor say aye.
Aye.
Opposed, the same. Motion carries. The approval of the closed session minutes of August 4th.
Move for approval. Support.
Okay, motion by Inman, supported by Fleece for the special minutes. They're on your desk this morning. Further discussion? Those in favor say aye.
Aye.
Opposed, the same. Carried. Brings us to the first opportunity for public comment. Is there anyone in the audience wishing to make public comment at this time? Morning, Jamel. Seeing none, we will move forward with the approval of the agenda.
Motion to approve. Support.
Motion by Hooper, supported by Inman, to approve the agenda as provided. Further discussion? Those in favor say aye.
Aye.
Opposed, the same. We have no special order of business this morning, therefore we'll move on to the consent calendar. If you would, please, Sam.
The purpose of the consent calendar is to expedite business by grouping non-controversial items together to be dealt with by one commission motion without discussion. Any member of the commission, staff, or the public may ask that any item on the consent calendar be removed therefrom and placed elsewhere on the agenda for full discussion. Such request will be automatically respected. If any item is not removed from the consent calendar, the action noted, receive and file, or approval is approved by a single committee action adopting the consent calendar. A, receive and file. 1, 13th Circuit Community Corrections Report for August 2010. 2, the prison commitment rate. 3, the THIS Transition House, PRS Probation Residential Services, and TAS Traverse Area Support Services reports. 4, the Veterans Services Activity Report through August 2010. 5, the Veterans Services Draft Minutes of September 16, 2010. 6, the Commission on Aging Program Report, etc. 7, the 2010 Client Survey. For approval, 1, Grand Traverse Sheriff's Office Surplus Vehicle. 2, Comprehensive Planning, Budgeting, and Contracting, the PCBC Agreement for fiscal year 2011. And 3, Renewal of Counseling Services Agreement.
Having heard the consent calendar, is there anyone in the audience wishing to have any item removed? Any member of the board? Seeing none, I'll entertain a motion to approve the consent calendar.
So moved.
Support. Motion by Thomas, supported by Stepka. Roll call vote, please.
Commissioner Inman,
Yes.
Stepka,
Yes.
Richardson,
Yes.
Thomas,
Yep.
Fleece,
Yes.
Hooper,
Yes.
Chairman Wheelock.
Yes, ma'am. This brings us to the Commission on Aging report. Good morning.
My name is Georgia Durga. I'm the Director of Grand Traverse County Commission on Aging, and I brought with me today George McBath, who's wearing two different hats. One, he's the Commission on Aging board member, and the other, he is the Senior Center Network organizer for the Grand Traverse County, and he's going to give you an update on what's happening with that. First of all, I'm In regard to approvals, we're asking for approval of an agreement to partner with the Area Agency on Aging and Disability Networks of Northwest Michigan, and I'm sure several other agencies, to form an Aging and Disability Resource Center. The agreement has gone to Bob Cooney for review, but I haven't heard back from him yet. That went in September. And the Commission on Aging Board approved it pending Bob Cooney's review. And it's, just so you know, it's an agreement to work in partnership with these other agencies, but it is non-binding. So at any time, if we feel that it's not in our best interest, or the Commission on Aging or the county's best interest, we could pull out at any time.
Any questions for Georgia? Georgia, is there a fee to this membership, or no, it's just a collaboration effort?
Just a collaboration right now.
Any questions? I would entertain a motion to sign this agreement pending the prosecutor's approval.
Support.
Motion by Stepka.
Motion.
Support
So
by
moved, sorry.
Richardson. All those in favor say aye.
Aye.
Opposed, the same.
And then the second item was, I wanted George to give an update on what he's been working on as far as the countywide senior center network.
Good. Thank you, Georgia. And good morning to everyone.
Morning, George.
The countywide network for the senior issues is something that I've been working on since August, and we're starting to get to the point now where we're having a lot of progress and a lot of excitement with the seniors in Grand Traverse County. We had our first meeting of townships over at Interlochen, at the Interlochen Public Library. And that included Long Lake Township, Green Lake Township, and Blair Township. We had it on the morning that we had that tremendous rainstorm. And when I was getting set up there in the meeting room next to the library, I was just sweating it in the morning. I said, oh my goodness, nobody's going to come out. But we had 71 seniors show up for that meeting. We had an excellent, excellent turnout. They didn't even know who our surprise speaker was going to be, but we had a wonderful turnout. They were very excited about doing something and bringing programs out to that area for the seniors. And we had 16 people from that group sign up to work with me further on developing the programs and what the seniors in that particular area want. We do not go into these areas with a set routine or a set expectation from the seniors. That's each one that we do is going to be developed depending upon what the seniors in that particular area want. So we could easily have 4 or 5 programs going on in the county when we get established that are all different. There's no problem with us doing it that way, and I think it gives the seniors in their particular areas the choices and the things that they particularly want and that will develop over a period of time. So we're very excited about it. We've got 2 more meetings coming up next week. We have a meeting with Acme in Whitewater and East Bay Township coming up on the 11th, the evening of the 11th, next Monday. And then on the 14th, we have a meeting coming up in Kingsley. We're going to hold that meeting at The Rock there in Kingsley. Some of you are familiar with that building, but that's the facility that was remodeled, that was the fire department hall and the village hall. And the township hall was there at one time too. But those people have all moved on, and that's been developed into a wonderful community center there. So we're going to have that meeting there. The other thing about the meetings is that in all of the people we've worked with, which started with all of the townships and the township supervisors and their boards, we've also worked with all the local libraries. We've worked with a lot of the local churches. All of these people have been very, very enthusiastic and offering us all the help that they can do. Most of them have meeting rooms that we can use at no charge. So we have a lot of things that the seniors have choices in their particular areas. And we're looking forward to moving forward with this, and by next year we'll have a nice program started all around the county for the seniors, and it'll do nothing but grow as they develop their needs and wants and desires, but we feel very good about it. It's been well received and by everyone we're dealing with. Are there any questions that we have for the program?
Any questions for George? Okay, the only suggestion that I would make on November 4th from 9 to 12, we have a joint meeting with the townships
Oh, okay.
at Twin Lakes. And I'm going to ask that you be put on the agenda. That'll be after the election, so we'll know whether or not the senior citizen millage or senior center millage passes and all those kind of things. And maybe at that point, hopefully we'll have all of the townships in one place, and you could just give us an update on that, them and us all at one time. Might save you running all over the county.
Well, I'd like to, Sonny. I've been meeting with all of the township supervisors, and they've been extremely courteous and extremely helpful in everything we're trying to do. And they've helped us with our newsletters. We've got meetings with chamber members in their particular areas, and they've offered us, in many cases, if they have a meeting room that we can use. So,
I'm not sure how full that agenda is that morning, but we'll at least carve you out a little piece that we can just kind of have an update of where you're at that point. And
great.
You can make the presentation to all of us at one time. Might save us all some time.
Good, thank you.
Anything else for Georgia or George? Thank you for coming in this morning. Grand Traverse Sheriff's Office. Morning, Nate.
Hello, I'm Nate Elger with the Sheriff's Office. First item we have before you is our Burn Justice Assistance Grant request for approval. It's a matching grant. We budgeted for 2011 $35,000 anticipated revenue from this grant, and they are going to authorize $34,560 for the 2010-2011 grant year. We're asking for approval to accept that.
Move for approval.
Support.
Motion by Inman, supported by Fleece. Any questions? Nate, I assume that the matching funds are budgeted in the 2011 Sheriff's Department budget also, correct?
Yes, they are.
Any further questions? All those in favor say aye.
Aye.
Opposed, the same. Motion carries.
The second item we have before you is a request to go out for proposals for digital dictation. This is something we approached the board about several months ago, and then I believe it is in the 2010 Capital Improvement Expenditure Fund. We have bid this out previously just for a cost estimate. That cost estimate was approximately $55,000 for the entire system. We have decided that some of the attributes that were in the initial bid we will not probably take advantage of, so we're guessing that would be significantly less than that. This is something that is going to replace our tapes, our metallic tapes system we have right now of transcription and dictation. The recorders are becoming obsolete and tapes are becoming harder to find, and the transcribers are very expensive to fix once they do break. The digital dictation system also offers some potential storage savings, so to speak. Right now we print out our reports on a piece of paper, and that piece of paper is manhandled into a filing system and stored for a period of time that is determined by our records retention policy. We have the option with digital dictation to store these items digitally and not actually type these items until they're requested either by an attorney or through FOIA or by another officer. We're not saying we're going to do that at this point, but it certainly is a novel concept for us. So we would like to move forward with at least requests for proposals at this time.
Larry?
I would move that we allow the Sheriff's Department to go out for an RFP for digital dictation equipment.
Support.
Motion by Fleece, supported by Thomas. Further discussion? All those in favor say aye.
Aye.
Opposed? Oh, I'm sorry.
I have a question.
I'm sorry, Ross. Go ahead with the question, and if we need to, we'll revote.
Okay, is this something that could be handled by the ICE money?
I believe it could be, Mr. Richardson.
Okay.
It's a new thing for us. It's an improvement, actually. It's
Right,
not just a
right.
replacement of an existing. It is an improvement, but, yeah.
So basically, each officer is going to have some sort of a device that they can dictate into, but it'll be digital instead of what we're using now.
That is correct.
And then basically you can download what that dictation was to a computer and store it that way. I mean, that's a possibility. I understand you haven't made that decision yet.
That is a possibility, yes. And the city police also will be getting, potentially, digital recorders as well. They still right now use a tape system, so we are trying to work with the city to either bid this together, or they would purchase their own digital recorders at a later time.
Because it's our central records employees that actually deal with producing the reports, correct?
That is correct.
But not every dictation results in a written report, is that what you're saying? Or that's a possibility?
It is a possibility that some of the non-criminal complaints, right now, anything over a 7700 file class, which is a non-criminal file class, so a civil dispute or a standby, a civil domestic, those can be reduced in handwriting to a yellow sheet form, and that is filed. The clerks don't do much with that. This would be something similar, that if an officer wanted to do a report on a non-criminal complaint, he could dictate it, store it electronically, and never touch it again unless he or an attorney or the subject involved wants to FOIA that report.
Okay, but criminal complaints are all...
They're going to be typed.
All result in a paper copy?
Yes.
Okay.
Okay. Are you okay with that now?
I'm fine.
Let me retract what I just said.
I'm sorry.
We have spoken with the prosecutor's office about the possibility of electronically sharing this information to reduce paperwork. So I'm not going to say we will not be able to not reduce those to paper in the future, but right now, the system is we're going to reduce criminal.
Right now, that's what happens.
Yes.
Okay, thank you.
Okay. Dean?
Just, I should make a couple of comments here, considering my position and also considering that I'm here on behalf of Dennis. The undersheriff is correct. This was one of those projects that Dennis and I did identify. You had asked us to do that when we were putting the 2010 budget together. There were 13 projects that we identified as possible funding items out of the CIP fund. Those projects totaled $1,252,000. The jail generator was at the top of the list. I think facilities is working on that currently. The imaging implementation, and $150,000 was also in that. I'm just hitting some of the big items, and as was the records management system. And there was $50,000 included for the digital recording, so it was identified. But this list was put together, quite some time ago. Things have changed a little bit since then. This year, to balance the budget, we had to reduce the appropriation to the CIP fund by $300,000 because of the tax reduction in tax revenues. There are funds there to cover this, but I think we need to evaluate this in the context of everything else that we were not able to fund in the 2011 budget. So I'm not saying that we can't do this at this point in time, and I think your action is to authorize the sheriff's office to go out for proposals, and I think that's fine. But as to the funding source at this point in time, I think we need to take a closer look at that. So.
Well, I think it's my understanding that the request was to go out for bids. So once the bids come in, the dollar amounts come in, then we will determine whether or not funds are identified to make the purchase.
And then one last comment, the work that we're doing on the governmental center stairway project out to the south of the building was an additional project that was added to the list that is currently being funded out of the CIP fund, and that has a $61,000 cost. So it is on the list, and there are funds there to do it, but we do need to determine that funding source.
All right, thank you, Dean. Russ, are you okay, or do you want to revote the issue? Did you get the answers that you needed?
No, that's fine, I'm happy to show. Did you finish the vote when I interrupted it, I guess is the question.
Okay, all right, so let's just vote. All those in favor, say aye.
Aye.
Opposed, the same. Motion carries. Thank
Mr.
you.
Chairman, can I have just a quick follow-up question for Nate?
Sure.
Regarding forfeiture funds? Is the rule, it has to be new, it can't be a replacement? Is that one of the rules?
It has to be something, it cannot just be a replacement. It has to be either an expanded service, an improved service. It cannot be replacing a patrol car with a patrol car.
Oh, I'm following you. All right.
Yes, there has to be some improvement. I believe because of the enhancements in the software and the ability to manage that system a little better, I think we could probably pull that off, but I would have to look more in depth at it. We did not come here with that in our mind. We came here knowing that we've discussed this previously about funding it out of the capital improvements budget.
With regard to moving forward with your storage building, is it possible that we can potentially get a estimate of what's left in the forfeiture funds and maybe the timeline that you have to spend that, and maybe your plans to, what plans would you have to absorb that, or just,
Yes, I don't
You know,
have...
at a later date?
Yes, can I email that to Dennis or Dean and have them
just-
provide that?
just next month would be
Oh,
fine.
okay,
whatever.
very good.
Yeah.
Okay, we'll have it next month.
Anything else for the undersheriff? Or the sheriff is here also? Seeing none, we'll move forward.
Well, I do
with-
have one, can I bring up one topic for you, though?
Oh, okay, sure.
We did receive notification from Long Lake Township that they will be discontinuing their CPO position at the end of this year. Karen Rosa sent us a notice well in advance of that, and that was a question that this board had of us during budget discussions, was whether or not we had seen any other townships that were potentially not going to be able to fund their officers, so I wanted to bring that to your attention.
Thank you.
Thank you.
Okay, third level crisis intervention.
Good morning. My name is Jolie LaRoche, and I really appreciate your time in letting us share with you what we're working on. It's a grant we received that's being dispersed through Michigan Department of Community Health. It came from Garrett Lee Smith Funds, which is a senator's son that unfortunately died from suicide several years ago, and so he instituted federal funds, and we were able to win one of the grants in this state to work towards this very important issue that we know is a concern to all of you, and we appreciate your leadership in our community, so we wanted to let you know what we're doing to work with all of you and engage as many members of our community as possible to work with this issue. We just wanted to let you know, we'll go over just a little bit why we're doing this project, just a few data related to youth suicide and what we're doing in our community. As you all know, it's become a public health concern. The issue of suicide, obviously, it doesn't just only impact youth, it's a widespread issue. Right now, numbers-wise, the largest risk number is in our white males, ages 25 to 44, and then our largest data group is in our elderly population. But because of the nature of this particular grant that targeted youth, we're working with young people ages 10 to 24. In 2007 in Grand Traverse County, we had a spike in youth deaths. So there was actually 8 just alone in Grand Traverse County. So that's one of the reasons why we were successful in getting the funds for this particular grant. When you look from our data from Michigan Department of Community Health in 2008, we notice that suicide is significantly higher than some of the other issues that we look at in our community and statewide as compared to homicide and AIDS. The death rate for suicide was significantly higher. And even in 2007 to 2008, the rise in suicide rose by 50 cases, whereas homicide actually dropped. Just a few statistics that might be surprising to some of you. I know it was to me as I started getting involved in this project. For every youth suicide death, there's actually an estimated 100 to 200 attempts. And in the adult population, there's typically only about 25 attempts. Firearms are still the most common method used, and that's with youth as well as the adult population, although we are starting to see from research that suffocation, which would be hanging, is rising. Males complete suicide still at a rate 4 times that of females. However, females are attempting 3 times more than males. And youth, nationwide, it's the 3rd leading cause of death in our 15 to 19-year-olds and our 2nd leading cause of death in college youth. And some of the research actually indicates, at least in Upper Michigan, that it tends to be the 1st leading cause of death in our young people. This is a map taken out of CDC recently put together a data mapping system. It's called Whiskers, and this just indicates to you just kind of visually the areas of higher concern statewide. And as you can see, Grand Traverse County is a higher rate, and then of course the UP and some of our surrounding counties if you look at that rate. This just also gives you another visual. Comparatively, Grand Traverse compared to Michigan and US, we are higher in our 10 to 24-year-olds for that period of time. We also wanted to show you just they've done a 5-year moving average of looking at how we started back when they were tracking this data, 1989 up through 2008. And as you can see, each year, pretty much it's been rising. So we can continue to be concerned about this problem and know that there's ways that we need to be more active and proactive in working with these young people. Every year, schools have the opportunity to participate in the Michigan Risk Profile. It's something instituted at the school level. They look at a variety of factors, risk behaviors, substance use, as well as violence, and suicide is considered in that category. And we just wanted to show you a few of those pieces that were reported in the 2009-10 school year. And this is based on the questions to these young people. They were asked in the last 2 weeks if they've been experiencing this over a 12-month period. And as you can see, Grand Traverse scored much higher than the U.S. rate for young people feeling sad and hopeless. And you can see those statistics for having suicidal thoughts, a suicide plan, actual attempt, and then that last category, attempt, resulted in medical attention, means that what they actually did required them going to the hospital and getting some sort of intervention. And so we continue to be concerned about what's going on with our young people. And you can also see kind of our statistics for Antrim and Leelanau, which were the only other 2 counties in our region that participated in this for the 2009-10 school year, although our plan is to expand into a 5-county region. Yes?
Have you interviewed any of these people to find out why it's higher in Grand Traverse County? What social causes there are, perhaps?
I have not interviewed. What we're aware of with our youth workers that work with these kids. We're a rural population, which tends to make it higher. Tribal communities make it a higher rate. They're not really sure what caused the 2007 spike, but certainly the factors, any kind of loss, financial stuff that's going on, it impacts our young people. And so because we are concerned, and I can tell that you all are concerned as well, these are some of the ways that our particular team is working. There is a Leelanau Grand Traverse Suicide Coalition, and we had some of those members that were willing to join our PAYS leadership team. We meet on a monthly basis, and we have a plan, we have specific goals, and so we are working together to try to figure out what we can do to minimize the risk among our young people. One of the things that we're doing is awareness presentations. I'm currently giving those. I've talked to the Leelanau Coalition, I've talked to Grand Traverse Coalition, Department of Human Services, and then just presented last week down at Michigan Network for Youth and Families. And I just thought I'd show you a little bit of a condensed version of what we're just making people aware of what they can look for in warning signs and risk factors and how to get involved. Particularly in our adolescents, you see these 4 categories of things you especially want to pay attention to. We look at our marginalized young people, so sexual identity issues. For those of you that are not familiar with that acronym, it was something new to me a few years ago. The GLBTQ stands for gay, lesbian, bi-attractional, transgendered, and questioning young people, just a higher risk group for obvious reasons, and you've heard news reports recently, especially our young person in Rutgers University that just took his life related to those kinds of issues. Any kind of trauma or loss, so that includes everything from death of a family member to either suicide or just natural causes, as well as divorce in family, remarriage in family, sexual abuse, physical abuse. So it's really helpful for our Department of Human Services folks getting that prevention in there, intervening, because what we find is young people that have experienced this have a higher risk rate over their lifetime. Substance abuse and mental health issues, both of those are significant risk factors in both our young adult and adult populations. And sometimes they're also co-occurring disorders, and we're not really sure which one starts first, but we're just aware that those are significant factors. We know that the adolescent brain is continuing to make those connections up through about 24 or 25, so understandably any kind of substance use also interferes with their decision-making processes and can impact depression and other types of high-risk behaviors. The aggressiveness and impulsivity of young people is also a problem in this group. So not only the normal risk-taking that teenagers make in this area ends up being fatal. They don't have necessarily the cognitive abilities to understand the finality of what they're doing, and they don't think it through. The aggressiveness, we are concerned about those being bullied, but what research also shows is that the bullier is also at higher risk. We also want to look at protective factors. How can we build the resiliency of our young people? This is a model that was taken out of by a gentleman out of South Dakota that was working with tribal community young people, and he discovered these categories was a good way to let us know ways to build their resiliency. And they're all pretty self-explanatory, but generosity opportunities, for example, opportunities for young people to give back to our communities, be involved in service, increases their self-esteem, gets their focus off their own problems, and can also help just overall in their development. Having that access to mental health, reducing the mental health stigma. We still have a significant problem in our culture. People have a problem with thinking there's something wrong with you if you need to get some counseling help, and we're trying to work with that and just making that aware as a society that everybody sometimes needs somebody else to talk to. Healthy activities, we're looking at things like what's impacting our diet, being aware of that, how can that impact our health. Getting enough sleep, our young people like to burn the candle at both ends, but we're aware now from research that they're needing just as much sleep sometimes as the toddler age group. And if you don't get enough sleep, it can impact behaviors, mental health issues like depression. Exercise also can be an excellent proactive way to avoid medication or at least mitigate medication needed for mental health issues. Spirituality. Research shows young people involved in youth groups is helpful, and not only just your standard Judeo-Christian viewpoints. We're finding that like Native American youth, they've done some studies with the medicine wheel, very helpful. So having some kind of spiritual connection also tends to be a protective factor with these young people. And what we also know is any kind of caring adult relationship. So that means any of you and any of us in the community can have an impact on a young person. It just takes one adult being involved in a young person's life, no matter what's going on in that young person's life, that can be significantly helpful and protective. These are just some warning signs to pay attention for in your young person and your grandchild and your child, maybe even with a coworker. If they're saying things like, I'm not sure it matters anymore, they'll wish they hadn't. We sometimes see young people trying to get back and letting you know that they're really in a lot of pain. I won't see you again. And following up on that, don't just let those kind of comments go without talking to them further about that. Other warning signs that you start looking for and realize that you need to intervene. If somebody's threatening or talking about their desire to hurt or kill themselves, if you notice that they're trying to gain access to firearms, this is really important for our parent population to understand that this is a method that young people are seeking, and just because you have your gun locked up in your house does not mean that your young person is safe. So figuring out a way to remove those items from the home if you're aware that your young person is at risk. Pills. And there's more and more access to pills available when we have our prescription drugs at home, and we're seeing an increase in young people overdosing. Focus on writing or talking or listening to very dark-themed things, writing about death and dying and suicide, and giving away prized possessions are all things that are indicators we need to intervene. Ways that we talk to our individuals that attend the awareness presentations about helping is just being direct. Suicide is not something that our culture wants to talk about. It's not a pleasant topic, but being willing to actually ask that question and just be open and matter of fact. Are you thinking about suicide? Are you thinking about killing yourself? And this is really an important time to be giving them that non-judgmental listening. This is not a time to be giving them a lecture about all the reasons they have to live, or that they shouldn't be doing this because it's morally wrong or anything like that. It's just giving them the opportunity to talk. Avoid daring or calling young people's bluff. We all probably have run across people in life that use that, but that's also an indicator that they need some help. Avoid acting shocked. This can be difficult to do when you're having somebody, especially in your own personal life, and it may be your child in your home, saying that it's difficult. But being aware of how you're coming across will open up that lines of communication. Not agreeing to secrecy, and trying to help them find the hope again without telling them that everything's going to be okay, because sometimes things aren't going to be okay. We need to help them manage in other ways. And actively pursuing safety, and then helping connect them with professionals that can deal with suicide if this is not something that we're skilled with. Some of our local community referrals, obviously emergency room. Our agency is open 365 days a year, 24 hours a day, and it's completely free and confidential to everyone. Community mental health, Pine Rest, and of course our school professionals, social workers and counselors and those kinds of individuals. And another thing that we are doing is empowering our community members to be proactive and capable responders. So we've already been in this past year and already just did another training 2 weeks ago, offering evidence-based trainings to increase people's ability to be willing to ask those questions and be prepared to listen. So Safe Talk, ASSIST, which is Applied Suicide Intervention Skills Training, and AMSR, which is for our mental health professionals, which we partnered with Pine Rest this year in July. They offered a training for their mental health professionals. It's pretty intensive, full-day training, and I'll describe a little bit more about those in a moment. Our prevention, it's very important. We look at this as a river of suicide. If you've got individuals in that river, we've got helpers all along this river to try to help and get them out. So we're trying to do prevention strategies, but that's not going to help everyone. And then we have the postvention, which is our wonderful individuals at CMH and those kinds of people that are helping once somebody has tried to harm themselves. And then we have the suicide first aid, which helps everyone get comfortable about intervening once there is a problem. Safe Talk is geared towards anyone ages 15 or over, and it's really easy for the average layperson. It's a 3-hour training, just helps them be able to identify people who have thoughts of suicide, and then we teach them the acronym TALK, tell, ask, listen, and keep safe, to help them be willing to connect somebody with somebody else that's willing to intervene. The Applied Suicide Intervention Skills Training, this is a little more intensive. It's a 2-day training. And people actually do a lot of role-playing the second day of being able to engage someone, and it can be a very moving experience, and it's for all levels of our community to get involved. The other way that we're working in our community is empowering and engaging our schools. We have offered money to several schools that signed our contract when we first put this grant together, and we are wanting to have suicide prevention specialists as in many schools as possible. And what these persons do, they take a training, it's an online course, and it helps them learn more. So they're essentially going to become their school expert on suicide, so they can make sure there's a suicide risk plan, what to do if the worst case scenario happens, helping that student reintegrate after an attempt is made, and even paying attention to such things as litigation outcomes and what it's going to do on your school population if there is a suicide. The other piece of this is empowering our young people. We know that peers are very successful in working with their friends and also tend to be a very strong force in their life. So there is a evidence-based training called Signs of Suicide that several of these schools are also willing to implement. And it just goes through, they can offer it during their health class or some other avenues. And it helps these kids get prepared to acknowledge, care, and tell. And it helps break down that code that they typically have of keeping a secret and being willing to help get their friend to care. These are the schools so far that have currently signed on with us in our area. We've got a couple outside, but I thought you'd just be interested in our Grand Traverse area. You'll notice Traverse City West, I've got an asterisk on that Signs of Suicide. They actually already implemented this program in their school prior to us getting this grant, and they were one of the schools that were hardest hit by those 8 deaths I referenced in 2007. And then these are ways that any of you can get involved and that we just keep encouraging our community to get involved. Attend any of those gatekeeper trainings. Get involved on the internet. American Association of Suicidology, Suicide Prevention Research Center consistently has data and evidence-based resources to look at. Offering workplace information, so posters up in your office. I've got magnets today if anyone needs for Suicide Prevention Lifeline, which is something else that Third Level Crisis listens to, and we handle suicide calls from 989 and 231 area codes. The Prevention Coalition, always willing to take any extra hands, and just helping us encourage suicide prevention and intervention in our community will be especially helpful, encouraging those schools to get on board with us and helping us get into other agencies so we can increase awareness. And just really helpful to remember that most suicides are preventable, and together all of us can make a difference. I appreciate your time.
Thank you, Jody. Are there any questions for Jody? Ross?
So you got a grant for this program?
Yes.
How long is the grant for?
3 years.
3 years.
So we just started our new cycle here in October. It started in March, and we just started our year 2.
Good job, thank you.
Thank
Thank you very much. Central Dispatch. And Jamel is back. Although she's going to sit in the corner.
Wow.
Good morning, Jason Torrey, Deputy Director for Central Dispatch. We are here to give you an update on the status of the PISA grant. Give you a little recap on where this started and where we're at today, and then I'd like to, first introduce Max Machuda with Municipal Services Consulting. He's the current consulting gentleman for engineering and strategizing where to go with the grant monies.
Good morning.
Morning. But this was first introduced in February, March of 2009 to you folks, and it's been a long process to get to where we're at today, and it's still not well-defined. But just to give you a brief synopsis of where we're at, how we got here. The region received a $1.3 million PISA grant, which is a Public Safety Interoperability Communications grant, and they hired RCC consultants, who many of you attended a presentation by them to go over their feasibility study to best approach how to utilize that money in the region. What they determined is that the best thing we do would be to virtually consolidate 3 different projects, or let me back up, 6 PSAPs, 2 PSAPs per project, making 3 projects out of 1 grant. And one of those projects would be Leelanau and Grand Traverse County. The other being Alpena and Alcona and Roscommon and Crawford. So it builds on the complexity of the grant because you have 3 different projects and 1 pot of monies. Each project requiring a different need, and obviously it's going to determine how the monies are split up. Anyhow, we got to we agreed that the virtual consolidation concept was the best for the region. They then hired municipal service consultants to go ahead and start developing a plan to strategize on how best to approach that, and what hardware, software, equipment, planning process would have to take place in order to make that happen. So I'd like to have Max talk about where we're at today and what his involvement is in the project and what we're asking of you.
Again, good morning. What the project, basically the grant is broken up into 3 different phases. Phase 1 being the intersection of CAD and networks back and forth between the 3 groups of centers. The second one being how to create a robust fiber network that goes between all of the centers. And the third, addressing the remaining funds allowed to increase and/or upgrade your current equipment in the 6 different dispatch centers that is either outdated, unmanageable, unsupported by the manufacturer, but allowing us then to address replacing that equipment under the concept of narrowbanding for interoperability. So that being said, where we are today is phase 1 of the projects have been engineered, and the requests are into NTIA at this point in time, which is the group that manages the PSIC grant. And that basically leaves a residual of around $394,000 for phase 2 and phase 3. There was a meeting last week by the Region 3 Communications Committee, which they determined that phase 2 needs to be to intersect all 6 of the dispatch centers by some type of means of either fiber connectivity or fiber and wireless together to allow the information to pass through as we develop the centers down the road with more funding or other grant issues that come up at that point in time. Then phase 3 is going to be the residual money left after those engineering projects are done and implemented as to what we can do to address the current issues that you have. We ask each one of the centers to review their counties and come back with a list of equipment that needs to be upgraded. And Grand Traverse County's list is roughly $92,146. And that encompasses replacing the wireless links that control all of the radio systems within the county and upgrading ADAM 2, excuse me, Basin Comparator, which is outdated and basically unsupported and unupgradable at this point in time. So with that being said, Grand Traverse County's amount, if you look at the entire grant at what's residual left at this point in time, $1.068 million. Grand Traverse County would be roughly $178,000. There's a 25% match. That would be $44,500 required by approval of the board to allow us to proceed and finish these projects as rapidly as possible. We have a grant deadline date of April in 2011, and we need to, at this point in time, get the counties to commit to supporting the funding. At this point in time, Roscommon, Crawford, and Alcona have all committed to their portions of the funding.
Larry?
So I guess in a nutshell, these are funds that are available for communication infrastructure improvements and upgrading equipment, those kinds of things, so that the counties are all compatible with the same type of equipment so they can communicate with each other. Is that one of the goals?
One of the goals is to allow, first of all, each county to be able, in a team network, to back up the other county for all the type of services. One is CAD, and the second being radio, so that if anything happens at Grand Traverse County, Leelanau County can automatically take over and dispatch all your services, or versa versa.
Okay.
And then that does it all 3 teams.
All right. So there isn't any commitment in terms of some future understanding that we're going to have a combined central dispatch center between counties that are among this thing. This is strictly a infrastructure communication upgrade.
This is what they call virtual.
So everybody can back up each other. You'd have the same equipment and those kinds of things.
If I can interject real quick, there was 3 different scenarios in terms of how to consolidate these different projects. And one of them was a consideration for physical consolidation. I assume that's what you're referring to.
Right.
And that was determined as too costly and too it wasn't feasible. And they all agreed that the virtual consolidation concept was the way to go, and so did the PSAPs. The 911 centers agreed that that was the best approach.
Max, what was the amount again? 44,000?
$44,500 would be the 25% match required by the county
And when is that money needed?
by April of next year.
And that would be Grand Traverse County's match for the grant?
That's correct.
Ross?
Jason or Maxie, can you discuss a little more the benefits or the need for the virtual consolidation? Because I'm still struggling with the concept, honestly.
Right. The goal, there's quite a benefit actually to both Leelanau and Grand Traverse County in terms of having a dispatch center that's available at your neighboring county that would be available right now, right here, to take over for you in the event of an evacuation or a crisis or a natural disaster. We currently have a backup center in the law enforcement center that we would have to go man that, bring it up, make it work, and the limitations in your backup center, it's not working in your primary PSAP center. It's not working with your anti-alley, and your 911 capabilities are not quite the same. Your radio infrastructure is not quite the same. What this would do is enable us to have all of our radio infrastructure accessible from Leelanau County, as well as enhanced 911 service, which we currently do not have in our backup facility. We're able to answer the call, but we can't tell where it's coming from or who it is, which is a really big thing. And they would become our alternate PSAP at that point, in which Kalkaska currently is. And we have to address that at the same time, because if our 911 calls go offline or if they need to be rerouted, they go to Kalkaska County. Maybe back when that was first implemented, that was the right thing to do, but they're still a small center. They usually have one person working there. And for them to manage our calls plus their own is not the right place for that to be happening. And at the same time, Leelanau County would then be able to perform those same services for us and then we would for them. It's the way the 911 center, the 911 community's headed is towards interoperability and the ability to back each other up. Part of the project that Max was referring to is a fiber backbone. Well, if you start connecting all the 911 centers onto a fiber network, theoretically you could all back each other up. I mean, that's years down the road, obviously, but that's something that's feasible.
Max, the 44,000, does that complete phase 1 and phase 2 as far as the equipment upgrade? The
All
infrastructure?
3 phases.
All 3 phases as far as the equipment upgrade?
Correct.
Should be noted too that the equipment upgrade that he's referring to is something that we're going to have to address regardless if we continue with this project or not. That equipment is not narrowband capable, therefore it's got a deadline of 2013 to be replaced regardless.
That would be January 1 of 2013. By then, you're going to have to expend $92,000.
What action are you looking for today? Approval to move forward, or is this information?
I don't know if those are definitive numbers. That's kind of where we're at right now. This is still a fluid thing. We just had a meeting on Thursday which changed a few things, so we wanted to make sure that we had the most up-to-date information we had today available, with the hope that you'd continue the support and possibly bring this back to the board meeting later this month with the final numbers.
Our primary concern is to have the 6 counties that are in support of this at least be able to commit to the maximum level of funding that would be allocated to their county. And as we engineer the projects over the next 30 days, which has to be because of the deadlines, be able to come back to the board and say this is going to be closer to what your share is. until the RFPs go out and we receive the actual cost back for the equipment and services, we won't know what the final numbers are. Right now, we're just in a basic industry standard cost mode. This is what it has been costing to replace this kind of stuff in the past. But the RFPs are going to give us that ultimate nailed down figure. That's not going to be for probably 2 to 3 months before those come back. And with the deadline date we have, we're just trying to go see if the counties are still for this, supporting it, and if they're going to be able to commit to the funding.
Bruce?
I guess that's the question, whether we can commit to the funding. Is that something we take out of our contingency? I know it's not in the budget currently.
Maybe capital improvement.
Capital improvement? That's another one of the, but that's not on the list though, right?
It's not currently on the list. I guess to follow along Bruce's comments, though, wouldn't there be ongoing, and I guess I'm going to ask, what's the related maintenance cost for this equipment? This is additional equipment, and will those cost estimates that you bring back to the board include the annual maintenance on that equipment, or is it part of our existing maintenance agreements?
You currently will be upgrading CAD and the networks that you currently have right now. The increase in maintenance costs would be roughly around $1,500 a year.
Jamal.
At this
And
point
that
in
will
time.
be indicated or summarized in the cost estimates?
Correct.
I think Jamel wants to speak to this issue a little bit, so.
The only thing that I wanted to bring up, Jamel Anderson, Director, Grand Traverse 911, was the consideration of in-kind matching for those costs, and that is definitely probably something we will take advantage of. I think the issue is just saying we're not sure exactly how much we could offer for in-kind match, and we want to be prepared that in worst case scenario, we would be responsible for those actual dollars. Best case scenario, we'd be responsible for a lot less than that because we could match that with in-kind, and I just wanted you to consider that also.
Well, and I think during our budget process, one of the projects that we said was a cloud out there on the horizon was upgrading our 911 system.
Mm-hmm.
You know, I'm pretty confident we're not prepared this morning to commit that kind of funding. You know, we're going to have to see a formal proposal in true dollar amounts or something, at least conceptual amounts, something in writing that we can review and try to have Dean and Dennis identify the funding for. I suspect that funding is not available in the central dispatch budget.
No.
So.
I'm sorry, right, that's probably correct.
But I don't think any of us are prepared to make a commitment of $45,000 here this morning based on the presentation we've seen this morning.
Right, Sonny, I think we're just saying, okay, because this does change so much, because there's so many people involved, and like Jason said, the grant is complex, that basically they're wanting to just provide you this morning with the most recent information, because it's not the same exactly as the last thing that you were presented with, because it has changed, and then say, to maybe let you know that at the end of the month, maybe we may have this ready, or I'm not sure, Max will have to get with that to give you exactly what the numbers are and a formal request for approval. But right now, we're just getting the general concept out and saying, okay, this is where we are today, and we will have to come back and ask for that. And like I said, worst case scenario, we would have to provide the amount in dollars, but it's, I would say, pretty unlikely because we'd be able to come up with a fairly decent in-kind match with services.
Well, and I appreciate the information. I guess my comment would be that, when you have some sort of numbers, get it to us. We will act on it. We have Ways and Means, which is our financial meeting in 2 weeks. We have a board meeting at the end of the month. And I think we're all willing to have this discussion at whatever meeting it needs to happen. Okay. Larry, did you have something you wanted to add?
Well, the only thing, I think what Max is primarily after is perhaps the board's intent, if it would be to continue our support of this project. And I think the answer to that, once you have the firm figures, would be yes. We'll have to really do some digging, though, for the funds. But if Jamel's correct and you can provide a substantial amount of in-kind services, that would definitely help.
Well, I think 3 or 4 years ago, I probably led the charge in this area to consolidate 911 services because it's just foolish for all of us to operate these independent services. We can't staff them, they can't upgrade our equipment or anything else on our own. So consolidation, and even if it's a virtual consolidation, makes a lot of sense. Larry?
Jamel, because of the conceptual backup concept on this, are there any emergency management funds that would be available that would coincide with this grant because it would be considered a backup emergency center?
This grant is an emergency management.
So it's all wrapped into the emergency
grant.
center? Okay, all right.
Right. This was from emergency management.
Okay, I wasn't aware of that. Okay, all right.
Homeland Security funding.
Same, well, yeah,
Same
it's the
thing.
same,
All right, okay.
same
And
bucket,
Region
basically.
7 has the grant, they hold the grant, so none of these funds run directly through Grand Traverse County.
Well, Alpena County is a fiduciary on this one.
Not Antrim.
No.
Okay. Well, I appreciate the information, but like I say, I don't think any of us are prepared to commit the funds this morning, but we will act on the presentation at such point as you can actually give us something formal.
Okay.
Thank you. Thanks. And Dean can start identifying money.
If you want, I'll find it for you in the books.
Yeah, thanks. I'll pass on that.
Yeah, I don't
Thank
think you want Jamel to find the money for you.
Oh, sorry to hear that. Surprised she's here.
Okay, we have no unfinished business. Is there any new business, Dean, that you're aware of?
Not that I'm aware of.
This brings us to the second opportunity for public comment. Is there anyone wishing to make comment at this time? Good morning, Fred.
Morning. Fred Kiesler, Grand Traverse Health Department. The question was asked to me by Commissioner Inman about flu immunizations. The 13th at about 12:30 to 2:30, we're going to have a vaccination clinic here for county employees. But if you should come to the health department, not at noontime, we'll see if we, for you commissioners, you can just stop in and get a shot, and I'll take you on a tour of the building because the building is an issue coming up in November, and I did send out an invitation on that, and I know that some of you have gone through the building and appreciate it, and some of you may not have, and to really appreciate the real issue, the biggest part of the issue is the expansion of the dental clinic and how they're pretty packed in there, and they want to expand the services, and we've been working with the architect for that expansion, and so there's my deal for the day for you.
Fred, I have a question for Fred.
I have a comment too, but go ahead, Larry.
Fred, I want to thank you for following up with the board's decision on the discount prescription card through NACO, and I see you've got them out in some of the offices. I did speak with several commissioners that, from other counties that have this card, and so far it's been pretty well received in their communities, but they've done some substantial work in terms of marketing the information to those folks. And I'm just wondering, now that we've got the card here and you got the agreement signed, do we have any plans to kick this off in terms of like a press release, other, kind of a communication to the public that this is available? And then other counties have like put them in the township offices, they've had them at the actual pharmacies, they've did a wide distribution in terms of information and the availability for people just to easily pick these things up and use them.
There's several factors. One is that Janine Taylor left last month, who was our outreach coordinator, who was in charge of this program, and that's really crippled us. We've had two major resignations this summer. One is our nursing administrator who left in July, and then Janine followed some weeks after that, and we've not filled either position, and that's a whole issue in itself. Of the ability of recruiting. In this economy, it's kind of weird, is you have high unemployment, but you also have this issue of people's mobility is really restricted on selling a house and buying a house. And so being able to recruit somebody from outside of the area is quite difficult. You wouldn't think of that initially, but it's been an issue. So the other thing is that we didn't know when the program was to be initiated. That is, that when Janine left, I only had 5 days' notice. And when these arrived, they came in a box, and I didn't know what she had arranged, what pharmacies she had contacted. So we sent out 2 faxes to each of the pharmacies as to who was going to participate. So it's just been basically I've taken on that job myself. I and my secretary have been working on trying to get this thing coordinated. And we released some, and immediately some people called and said, they said Grand Traverse County isn't participating. So I got a hold of the people who were behind this program at NACHO, and they said, well, your person said we'll start October 1, and this was mid-September. So then we held off on releasing any more, and the people at NACHO were really good about changing the database so it started mid-September. So it had kind of a false start there, because the last thing I wanted to do is get lots of them out there, and then people find that we weren't participating and we didn't have our ducks in a row. So I held off a bit, and then we've started, and then I thought we'd do a little bit of a gradual start and then maybe roll it out a little later, and hopefully after I get that position filled. But yes, I think it's a good point, and I think it's going to be a good program. Later on, I'll be able to give reports from time to time as to how many dollars were saved in the county by people who use those cards. They actually tally that amount. I did get one pharmacist that wasn't real pleased about us doing it, but most of the pharmacies have fallen in line and seem to want to participate. And as far as I know, it'll go well, but it's just that. But I think it's a good point to bring up, and it is a difficulty we're having right now with a lot of extra work having been picked up by a few people.
Dean, you had a question?
Yeah, Fred always provides Dennis and myself with updates out of Lansing regarding funding, obviously, for the health department. And I didn't know if Fred wanted to make any comments, but there was the one issue with the TB funding.
Well, the state statute says that the county is liable for the treatment of any indigent person with tuberculosis, as people who have no means to pay for care. And but there are persons who fall, they would be classified as statewide, I believe is the term, meaning they didn't have a permanent address. And when we would have a person in that situation, we could apply for state money to do that. What we were informed last week, I believe it was last week, is that when the budget was finalized to Department of Community Health, that was erased from the line. So there is a potential liability that the county has that if an indigent person who doesn't have a permanent address shows up at the hospital or something and they have advanced tuberculosis, the county will be liable for their care. TB is the only disease that the county is totally reliable for. When HIV first came up, that was one of the things we health officers lobbied heavy for, is we didn't want to have to pick up, the counties have liable for treatment for all HIV persons or AIDS, as they did with TB, and we were successful in that. But the county is still going way back in antiquity in law, or have that liability. One piece of good news, though, is that is you approved with our CPBC budget earlier, is that amount does not include. That was an anticipated of a $2.7 million cut for CPBC statewide for local health departments, or what they call LPHO money. That actually, when that went through, the cut was reduced to $1 million. So actually, that'll help our budget a little. And so that was a piece of good news. The other piece of good news is 15 months ago or so, the state suspended adult dental care for Medicaid patients. And that would be people, it could be pregnant women, it could be anyone over 21 years old that qualify for Medicaid, such as people who are severely handicapped or mentally handicapped. So they have only gotten emergency care, which is mostly antibiotics and extraction. That's been put back in since October 1. And if you watch 7 on 4 last night, I was interviewed, is that that is now available. That has a lot of benefits because we have a real pressing problem of people who fall into this category of having virtually no dental care and having very severe infections. And these infections can affect more than just their teeth. They can cause heart disease and a variety of other things. So that's been reinstated.
Fred, thank you, and you did a much better job of explaining that than I ever would have, so.
What's the vaccinations you're providing cover?
3 types of influenza, including H1N1.
Thank you.
Any other questions for Fred? Okay, thank you, Fred.
Thank you.
Any commissioners have committee reports or anything to point out? Larry?
I was unaware of this, and in the Leelanau Enterprise, last Thursday's paper, last Friday, October 1st, apparently the band had built a septic plant, and they opened officially last Friday, and they're charging, according to this article, 8 cents a gallon, 33% less than the Grand Traverse plant, it says. Of course, I presume it's up in the Pashabi Town area, so, but I don't know how many of you knew that they had built that plant.
I heard it's, how much the capacity of the plant?
That I don't know, and it doesn't say, but the headline was of the article, expanded law won't affect county households, meaning, in Leelanau County, because the band's going to have the septic plant, which they started running last Friday.
Is that solely for travel?
No, this is for anybody in the county. Anybody can take septic there,
Yeah, we're not getting much out of Leelanau, but it doesn't help us.
For 8 cents,
So
they
the end
gotta have
product
clean
isn't going to
poop.
be as...
For 8 cents, they gotta have clean poop.
For 8 cents, they what?
Gotta have clean poop.
Yeah, but they, like I said, the only thing is the location, people in the northern part of the county I could see, but once you reach the mileage circumference, if you will, I don't know why anybody, you'd have to figure out, that savings of 4 cents a gallon would soon be eaten up by
The trucking cost.
gasoline, or fuel.
Any other comments by commissioners? Any announcements? No purpose for closed session, Dean?
Move for adjournment.
Support.
All gone. Thank you very much, everyone.
Good job, Tony.
Everyone, please.